we're going to really focus on inflammatory bladder disorders. And that means ketamine-induced cystitis, eosinophilic cystitis, and radiation-induced cystitis. Why? There's no guideline at this moment. We're creating one within the EUROGEN, ERN. It's an EU-funded program. We have a committee and is making guidelines for these diseases that are actually increasing in number. Chronic pain in their bladder, it's not staying there. Your pelvic floor will react to it. In cases where there's ketamine-induced cystitis, there's ketamine abuse, addiction, so you need also addiction specialists and so on. And other tracks like bowel function, in women also sexual function, so all are also affected by this. So we need to work as a team. Many organs close together and you get a domino effect. One affects the other, and there's also psychological components to this as well. So we need to work as a team to get these patients sorted out. So please register, come to visit and see some, especially, I'm not talking about mine, but the two colleagues that I have. One has a ketamine outpatient clinic and he runs in the Netherlands and he runs tons of patients in there, very specifically. And my other colleague from the UK, Sashi Malde, he has so much experience also in radiation-induced cystitis management and so on. Please go there and learn from people with a lot of knowledge on managing these diseases. It can help you also in your own clinic.